Hi, Dr. Brad Harmon with Harmon Dental Center in Louisville, Kentucky. With radiographs, everything's digital now. So we used to have dip tanks that we would have all these chemicals and it would take forever to get processed. And so they're just very, very quick now. And the big advantage of that is they're much lower radiation doses because we use a lot of software to enhance those signals and really be able to read the radiographs with much lower radiation than we used to. Technology is a big part of what we do here. I think we're very technologically forward, technologically focused. You know, the 3D version is so much better than the 2D version simply because we can see more. I mean, when you can see a three-dimensional object, you can see things you can never see in 2 dimensions. Well, there are a lot of structures in your mouth besides just teeth, right? We have bone and we have soft tissue support, and the 3D X-ray allows us to capture really everything in this whole field of view where we can really examine all those structures and see if there's anything pathology going on, bad teeth, bad roots, and things that we can't see clinically. We've had intraoral scanners since 2008, 2010. What that allows us to do is we can capture with a great deal of precision without all the goops and putties and pastes that we used to have to do to take impressions on people. And they've evolved quite a bit over the years. And so this is the newest iteration. We have the new Prime Scan from Dent Supply Sirona. It's the latest, greatest technology that they have available to us. Yeah, the digital workflow is better than analog just because it's much more precise and it's much less messy. The materials have shrinkage coefficients and they expand and they contract and they're in an airplane going to a laboratory. And so there's just a lot of error that can be introduced into the final product. People don't like having goop in their mouth for 2 or 3 minutes or more. And so a digital scan we can do within seconds and we can get an entire arch in less than a minute. And I see it as an investment in my patient's care. But really, it's about better patient care, better patient outcomes. You know, if you went into a dentist office and they wanted to place an implant and they were doing it with 2D imaging, I would be concerned. PRF, or platelet-rich fibrin. Yeah, PRF is, I call it the wonder drug. It's nature's Band-Aid. It's we take a small sample of your blood, we spin it down in a centrifuge, and we concentrate all those growth factors and clotting agents, and that product is a blood product that's been concentrated down to be reintroduced into the body for surgical wound healing. You know, it's an exciting time in dentistry. You know, I've been around for a couple of decades now, and it's been an interesting ride. And so it's hard to predict what would be next, but I think that biological intervention is going to be a key factor. I think the more PRF type products are going to be introduced into dentistry. I think things that will reduce surgical healing time, reduce the amount of out of work time people have. I think that's what we're going to see in dentistry. And so if you've not been to the dentist lately, things have changed. Things are much better. They're easier for you. They're faster. Stop by our office for a free consultation and see how dental implants can change your life.